It is usually somewhere between 8, 10 to 20 lies per day. Pathological liars, after they tell the lie, they will feel guilty about it. Hey everybody, this is Dr. B, and today I want to consider pathological lying, sometimes known as pseudologia fantastica, sometimes known as impulsive lying, sometimes known as mythomania, but pathological lying is what we will refer to it, and that's what I want to consider today. Why? It's interesting. There's a lot of confusion about it across the board, researchers, clinicians, and the general public, and I think it does serve some purpose to try to give some defining characteristics of it, if you'll allow me to indulge, and that will in turn give you some interesting and fun information, at the same time potentially help you in your life as you deal with these folks. Let's get started. Pathological lying. What can I say about it? We've known about it for probably over 100 years in the 1890s. Since that time, clinicians have been describing it and have been documenting it, okay? But as time went, we can say a couple of things. Although we have a lot of clinical descriptions of it and small case series and studies of it, what we lack is formal large-scale studies with defining characteristics. All of this is also in conjunction with the fact that it is of debate whether it is an entity on its own, and it is not at this time, so it is not in the Diagnostic Statistical Manual, or is it an expression of other disorders? Oftentimes, we're talking about cluster B, narcissism, antisocial behavior, borderline personality. And so there's this confusion, both at the research level, at the clinical level, and for the general public. Why this is important? If it was its own entity, if it did make it as a diagnosis, this is just an important issue, not to stigmatize someone, right? But now you have something to grasp your teeth on, create treatment protocols, and get insurance reimbursements. This is why this is important. And I'm going to try to update you, give you some information about it so you can actually have some understanding of it in a framework to deal with the world around you, maybe protect yourself, okay? So what do we know? Like I said, it's been around for 100 years. Some of the characteristics that seem to be coming out. And at the end of it, I will make some comparison and contrast with other forms of lying. And so hopefully that will really sort of put some teeth in it and tease it out. Certainly needs to be chronic. And, that's usually defined over 6 months. There's an impulsivity to it. It seems that although you look up in Google, it's 8 to 13% of the population. That number seems to be closer to 5 from some recent data from some really good researchers. And that will also probably change. It is usually somewhere between 8, 10 to 20 lies per day. The average person seems like 0, 1, maybe 2, okay? These things we do know about it. One other important thing, the motivation for the lie, okay? It seems to be coming out that it's an internal motivation when you're talking about pathological lying, okay? And that internal motivation is not driven by greed. It's not driven by gain. It's not driven by feeding your fantasy, but it's driven to relieve anxiety. Another important feature that seems to be coming out of the literature is it's initially driven to relieve anxiety. An hour later, 1 day later, 2 days later, there is a significant amount of guilt associated with the lie. These are all important features, okay? Keep in mind, I might have already said this, to make it into as a disease entity is not easy, right? There has to be certain features. For example, things need to be debilitating, okay? There needs to be significant chronicity to it, okay? There needs to be risks associated to you or those around you. So there's a lot of features for something to make it into the diagnostic manual as a disorder, a disease, or a syndrome, whatever you want to call it, okay? So those are the things we know about it. Oftentimes, in general, you will see people confuse pathological lying or I can't say confused because we don't have a complete definition and an entity, but given what I have said, I think we can draw some distinctions from somebody who is lying, and that lying associated with other entities versus pathological lying. Let me explain now. One of the things you see with pathological liars is they seek help. They'll actually call and say, there's issues in my life. It's getting in the way of my work, the way people look at me, the way my children look at me. You don't see the entities often affiliated with pathological lying in the cluster B category. You don't see narcissists calling somebody and saying, I need to come in. I'm a narcissist. It's getting in the way of my life, because they're grandiose and they have no self-reflection. You don't see antisocial folks calling and saying, hey, I'm antisocial. In their case, they see nothing wrong with them, okay? And so this may be something researchers can bite their teeth into and make a distinct category of pathological lying. In fact, pathological liars, after they tell the lie, they will feel guilty about it, as the research is starting to show us. A narcissist doesn't feel guilty. They'll feel shame if they're found out. And the narcissist has what can be described by the formal language for as ego-dystonic disposition versus ego-syntonic. They know something's wrong overall, but they're not going to say, I feel guilty because I did wrong. They did no wrong. But all of those entities, the cluster B ones that we just described, come with significant amount of lying. And there's a motivation. With narcissists, it's to feed the grandiosity or the fantasy or hide from shame or themselves. With the antisocial, it's always to gain a reward of some sort in the outside world. With the borderlines, is to protect their emotional lability and vulnerability, and they'll do what they need to for that. This group that's being teased out as pathological liars seem to have an internal motivation, which is to relieve anxiety and later followed by guilt, and without any other secondary gain in their mind. This is critical, okay? The other thing I want to point out about this, is there any sort of treatment modalities? It seems like, from what I understand, cognitive behavioral therapy and behavioral therapies seem to help. And what can you do to protect yourself against liars? And it almost seems like at a certain level where the line that goes on from personality disorder types versus the pathological lying, for example, you might ask one, hey, where'd you come from? They might say, I was just at 7-Eleven, but they just got gas. And they don't know why they lied, okay? It's not harmless because it is toxic and corrosive at any level when you start moving away from the truth. But to protect yourself in general, right, it's hard. And unlike the fact that you see a lot of shows about people that can pick up tells and lies, the average person in general sucks at being able to pick up deception. By the time you usually pick it up, you are already far into it. So use good, conscientious, protective hygiene all the time. If it sounds too good to be true, if it sounds fantastic, okay? If it doesn't match up, if it's a big deal, you should be checking with third parties. Just in general, have your awareness about you at all times, because there is no formal, surefire way to be able to tell. And the most dangerous ones, I think, are the ones associated with personality disorder. I hope this helps. Don't forget to like and subscribe. I'll see you next time. Peace.